Okay, which of the following pathophysiological mechanisms is most likely responsible for this patient's symptoms? We've got diastolic dysfunction, decreased afterload, systolic dysfunction, increased preload, or decreased heart rate. So we've got a 65-year-old man with a history of hypertension presenting to the clinic, complaining of shortness of breath, fatigue, and swollen ankles for the past 2 months. He's got JVD, bibasilar crackles, and pitting edema of the lower extremities, and he has a left ventricular ejection fraction of 35%, which is not good. Okay. So what causes this like congestive heart failure that we've clearly got here? Um, let me think. Isn't it, don't you have decreased preload and decreased afterload with congestive heart failure? But also I've got to think about the systolic and diastolic dysfunction, which you can get with like left heart fail. You get one of those with left heart failure. I'm not sure, but I do kind of think it's decreased afterload. I'm not sure why. So I'll pick it and we'll learn from this.
Okay. So the best answer here, right, to not get so crazy, right, to make it real easy is anytime you have a low ejection fraction, you have it's a direct correlation to systolic dysfunction.
Okay.
Okay, if you
Yeah.
have issues and the ejection fraction is normal, which I think normal is like 55 or greater, right? Then you're going to have diastolic dysfunction, right? So that's just the most direct answer. But let's kind of see, the rest here. So refers to reduced resistance against the heart. This generally improves cardiac output and is not the primary cause of patient symptoms, right? Because this
Okay.
is from hypertension, right? So you're losing ejection fraction, which is what the echocardiogram shows. So the best answer is, your systolic. Diastolic is not right because it's decreased, right? So decreased afterload will actually help the heart, right? Because you have less resistance in the arterial, and then increased preload will also, that's like high cardiac output failure, right? That means like an AV malformation or something like that that's getting more preload, and then decreased heart rate, right? I mean, that means so many different things, but that's not going to cause the issue here. So best answer is going to be your systolic dysfunction, which is a low ejection fraction. Okay.
Okay.